today I would like to introduce myself. My name is Angelica Ramirez, and I would like to take a few minutes to give you some brief information about gastric cancer, which is also known as stomach cancer. Stomach cancer is where cancer cells begin to form in the thin inner layer of your stomach. Symptoms for this disease are fatigue, feeling bloated after eating, feeling full after eating small amounts of food, stomach pains, nausea, vomiting, and weight loss that is unexplainable. In order for a physician or a doctor to verify if a patient has stomach cancer, they would do two procedures. One would be an endoscopy, which is a small, tiny, thin camera that is inserted through the mouth, down your esophagus, into the stomach, which allows the doctor to see what is going on. The second procedure would be a biopsy. A biopsy is a small surgery that is to remove a small amount of tissue from the stomach, which is then verified and checked to see if it is cancer. Causes for this disease would be eating large amounts of smoked, salty, unhealthy food, along with smoking, long-term stomach inflammation, and family history. Cancer, as long as many other cancers have or are known by stages. Stomach cancer consists of 4 stages. Stage 1 is where cancer has been detected in the thin inner layer of the stomach. Stage 2, the cancer has spread throughout the first layer into other layers. Step 3, the cancer has spread throughout all the layers and the muscles of the stomach and into the lymph nodes. And stage 4, this is where the cancer has spread throughout the whole entire body to other parts of the body. Once this is verified by the doctor will recommend 3 procedures. The first procedure would be a small surgery, or a surgery in which there is a small amount of cancer in the stomach. The doctor will do the surgery and remove that small amount of cancer. The second procedure is what is known as radiation. Radiation is something similar to an X-ray, and it goes directly to where the cancer has been located, and the process of it is to either shrink or dissolve the cancer, which this also helps and allows the doctor to remove it easier through a surgery. And the last process or treatment would be chemotherapy. Chemotherapy is where it consists of a drug that is inserted into the body, and it travels throughout, destroying, killing, and dissolving all types of cancer cells that may have spread throughout the entire body or other parts of the body. If the doctor has verified to the patient that it has confirmed that the patient does have stomach cancer, the doctor always recommends not only the cures and everything process for this disease or to survive through it, but also recommends for coping, support, and prevention from that process on. One of the tips that the doctors recommend is for the patient to become well informed about all that has to do with the disease, along with cures, procedures, so the patient can take or make the correct decision of what type of cure would be best for him or her. Another tip is for the patient or the person to associate with other cancer survivors, and like that it'll be easier for the person to cope, have an open-minded, and also have experience of somebody that has gone through this. And least but not last, the doctor also recommends the patient to be very active. Do not allow this disease to take over you or over your life. For you to be active and try to do as much as like exercising, healthy foods, and cut down on the salty, unhealthy, smoked foods, along with eating more fruits and vegetables, which contain a lot of vitamins and proteins that help fight against the disease. And the most important of all, stop smoking. The reason why today I chose this speech is because a year ago on March 15, 2013, I myself lost a loved one due to this disease. Before we knew my loved one was confirmed that she had this disease, we didn't really know much about the disease. And through her process, she took 3 years trying to survive this disease and fighting. And that's how we managed, or me myself managed to learn about this disease and take prevention. And I would say that this is it for now. I would like to thank you once again for taking the time to listen to my information, and hope that with this information I can not only help you or a loved one to survive through this disease, or at least have an open mind of what this disease is about. Together we can probably help save a life. So once again, I want to thank you, and I appreciate your time.